Representative Newton, your bill, since we don't have a quorum, we won't be able to move your bill. It's House File 2366. We have the bill before us, and I'm not aware of any amendments for your bill. Really? Really?
Really, Tony? Peace out.
And of all the members of this committee you're going to give cookies to, and it's not me.
Well, I thought, Mr. Chair, you know the standard procedure is to bribe all the committee members when you appear before the committee for the first time. So I'm honored to be the first person to appear before your committee. And now that Representative Albright is here, I guess we can move ahead.
Please begin, sir.
Mr. Chair, I'm introducing House File 2366, which is a bill to create a path to licensure for music therapists, and it would require that anyone who acts in the capacity of music therapist is licensed in the state of Minnesota. You know, we've come to recognize the value of music therapists in the treatment of children suffering from autism in our schools, especially veterans and others suffering from PTSD, and something that you and I have worked on, Mr. Chair, is the traumatic brain injury, as well as, you know, individuals with mental health issues. Currently, 7 states do license music therapists. We'd like to be the 8th state. This bill has passed both the Senate Health and Human Services Committee and the Senate State and Local Government Committee, and it has been referred to the Senate Judiciary Committee, where it's currently sitting. Senator Sharon supports the bill and wants to move it forward. However, she does not want to move it forward logically unless it goes through your committee and on to Representative Mack's committee. And as you know, Mr. Chair, because we're going to have such a short, fast, furious session, we want to get the bill moving as quickly as possible, but at least it's going through the Senate, and we're going to be able to make the deadlines through the Senate. So at this point, I would like to turn testimony over to Mr. Todd Schwartzberg, who's the chair of the music therapy program at the University of Minnesota, and he will also have 2 other people who would like to testify. Thank you, Mr. Chair.
Thank you, Mr. Schwartzberg. If you could begin your testimony. Because of the amount of testifiers we have today, we're going to ask people to limit their testimony to around 3 minutes.
Thank you, Mr. Chair.
Thank you, Mr. Chair, and welcome to the members of the subcommittee. My name's Amy Furman. I'm a board-certified music therapist and the lead music therapist for the Minneapolis Public Schools. I'm the immediate past president of the American Music Therapy Association and a Edina resident. We want to speak today on behalf of House File 2366. In your folders, you will find definitions and clear information about the bill. State licensure will help ensure that Minnesotans have access to music therapy services by personnel who are trained, equipped, held to high standards of ethics and professional practice, and demonstrate competency through board certification and continuing education requirements.
Mr. Chair and members of the subcommittee. My name is Todd Schwartzberg, and I'm a board-certified music therapist working as a professor and clinician in the music therapy program at the University of Minnesota. I'm also the president of the board of directors of the Autism Society of Minnesota and serve as the chair for our music therapy task force on licensure. I'm a resident of Shakopee. Official state recognition of the music therapy board certification credential will help healthcare facilities which rely upon state regulations avoid the confusion regarding the difference between music therapists, music practitioners, music thanatologists, and other non-music therapy musicians in healthcare. We are by no means attempting to regulate other professions. We want to ensure the public is protected if individuals present themselves as music therapists by requiring that these music therapists have met national standards of clinical practice. This proposed legislation offers a mechanism, licensure, as a viable solution with minimal government involvement. We feel this is a low-cost approach for the government and taxpayer, as we hope it will be budget neutral. We propose a voluntary music therapy advisory council, which will oversee license registration, re-registration, associated sanctions, and fines. Moreover, the license would be self-funded by fees assessed to board-certified music therapists.
Good morning.
Morning.
Mr. Chair, with your permission, my name is Barbara Else. I'm a new resident to Minnesota. I'm a proud resident of Rochester, Minnesota now. I'm the Senior Advisor of Policy and Research with the American Music Therapy Association and a board-certified music therapist. We have the support of myriad stakeholders, including family members, consumers, organizations, practicing board-certified music therapists, as well as our allied healthcare and special education professionals working around the state. Furthermore, this proposed legislation recognizes our clearly defined scope of practice, our clinical standards, and aligns with our required national board certification and continuing education requirements. My colleagues, clients, students, and I thank you for your time and attention to and support for this bill. I, along with my colleagues, are available for any questions you may have. Thank you.
All right, thank you, Ms. Ells. Do we have any questions for the testifiers at this time? Not seeing any questions at this time. I know we have a testifier in the audience that would wish to oppose this bill. And Mr. McGrath, if you'd come down and testify.
Mr. Chairman, members of the committee, Representative Newton, I thank you this morning for the opportunity to testify in opposition to House File 2366. My name is Lee McGrath. I'm the legislative counsel for the Institute for Justice. The Institute for Justice is one of the leading advocates of economic liberty and free labor markets. My colleagues have published the landmark publication License to Work, which shows the burdens that occupational licensing puts on individuals in their pursuit of their calling. Our research and our advocacy in state legislatures as well as in courts causes us to have great skepticism about occupational licensing. So this morning I'd like to talk about just three things. One is the bipartisan skepticism that is shared by other organizations in addition to the Institute for Justice. Secondly, the need for consistent thinking about what licensing really is. And thirdly, if I could be so bold, Mr. Chairman, to suggest that this legislation, as well as the next one, is legislative malpractice in light of the United States Supreme Court's decision in North Carolina Dental Board versus the Federal Trade Commission. So going to the first issue, the organizations across the political spectrum are now highly skeptical about occupational licensing. On the left, we have friends who we've worked with at the White House, at the Council of Economic Advisors, which put out a paper demonstrating the skepticism about its skepticism. The Federal Trade Commission, even the Brookings Institute. Also on the left is Governor Jerry Brown, and I've submitted to this committee Governor Brown's veto of this type of licensure, stating that private certification is significant and sufficient to meet the needs for a market signal. On the right, we are joined by the Conservative Heritage Foundation, the Cato Institute, the American Enterprise Institute, Americans for Prosperity, Morris Kleiner, the world's leading scholar who is at the University of Minnesota. As far as I can tell, Mr. Chairman, there is no public policy institution in America or in levels of the federal government that supports this level of occupational licensing. From a political perspective, Mr. Chairman, I would submit to you that you cannot be in favor of free markets and support occupational licensing. You cannot be in favor of the right to work and support occupational licensing. You cannot be in favor of limited government or economic liberty. You cannot be a conservative or a libertarian and support occupational licensing. And for my friends on the left, I'm happy to answer questions about this, but I submit to you that you cannot be in favor of social justice and support occupational licensing. Mr. Chairman, my third point is that this is legislative malpractice. The United States Supreme Court came out in a year ago on February 25th with the North Carolina Dental Board, and it removed the immunity from antitrust litigation on state licensing boards and identified the elements of removing that immunity. And those elements are in this bill. This bill proposes a board controlled and captured by the industry, in which the controlling factors are the controlling members are private providers. Now, if these private providers got together at a country club or a restaurant and decided who could enter the market, it would be clear to you that it's an anti-competitive restraint of trade. But they get together in an office building, a government office building, and they're doing the very same thing. They are restricting who can enter the field. So not only is this issue, this was the issue that Governor Brown recognized, that this is anti-competitive and anti-opportunity, but here in Minnesota, it is also contrary to Statute 214. I have not seen an analysis from this group per the requirements of Statute 214. So I'd ask this committee to not advance this bill any further, and I'm happy to answer any questions about my rather succinct and breathless presentation this morning.
Thank you, Mr. McGrath. Any questions for any of our testifiers? Representative Albright.
Thank you, Mr. Chair. I have a few questions for Mr. Schwartzberg. Mr. Schwartzberg, I'm looking at the bill as it's been presented to the committee, and I'm looking at page 4 with regard to lines 4.1 through 4.13. And before I go there, Mr. Chair, I guess I would like for Mr. Schwartzberg to describe for us, I guess, the payment structure that, or the compensation that typically is realized by working in this field, Mr. Chair.
All right. Mr. Schwartzberg.
Mr. Chair, Representative Albright, thank you for your question. If I'm understanding your question correctly, are you asking us what is the approximate salary or the approximate fees that music therapists charge in the community?
Mr. Chair, that is correct.
Okay. Mr. Chair, if I may respond.
Mr. Schwartzberg.
We are given approximate data from our American Music Therapy Association once a year that looks by region. And currently Minnesota resides in the Great Lakes region of the American Music Therapy Association. On average, that survey seems to indicate that music therapists are charging approximately between $40 and $50 an hour for services. Part of the rationale behind licensure in the state of Minnesota is to ensure that constituents in Minnesota that are seeking music therapy receive it from a trained and qualified board-certified music therapist. And many music therapists in Minnesota are trying to help our clients save money and and have access to our services. Some of us, and we had a let me see if I can find this real quick. We had a quote from a colleague at McPhail Center for Music who says, thanks, who says that under the Affordable Care Act and the Mental Health Parity, Addiction, and Quality Act of 2008, music therapy would be a service with mandated coverage. However, the only barrier for this now is the lack of formal licensure in the state of Minnesota. So many individuals, while they are able to have access to our services, they might not be able to pay for our services. As I stated, that is an average fee that is reported through a survey that is conducted by the American Music Therapy Association.
Mr. Chair.
Representative Albright.
Mr. Chair, and my next question actually would go to Mr. McGrath. Mr. McGrath, On page 4 as well as page 5, there is the delineation for a substantial amount of training, internship, and then on page 5 it speaks to the continuing ed requirement for this occupation. I'm just wondering if you have any knowledge of what that would compare to, say, any other continuing ed or minimum requirement for any other medical occupation, or if you might even compare it to someone in the financial services industry.
Mr. McGrath.
Mr. Chairman, Representative Albright, these requirements are excessive. In the state of Minnesota, for example, we license emergency medical technicians, and all they need is 150 hours of training. And so the person who carries you out of this meeting and rushes you to the hospital, who you are dependent upon in terms of making sure you make it to the hospital, needs roughly a tenth of the type of training that is suggested here. Moreover, this is the codification of a private certification. This bill attempts to codify in state law private certification. This type of capture is at the heart of the problem. It is at the heart for two reasons. One, it's not necessary, in that these musicians, I'm sure, are very talented, but they have gained private certification. So the market, the hospital, can get the signal from private certification. They do not need the government's blessing for that. And secondly, in the Affordable Care Act, there is great opportunity for this legislature to use any sort of market certification, any sort of market mechanism for people to qualify for insurance under the Affordable Care Act. You do not have to go to the most anti-competitive, most anti-restrictive, a mechanism that violates the Sherman Antitrust Act as being proposed here.
Mr. Chair.
Representative Newton.
Thank you, Mr. Chair. In listening to Mr. McGrath, I am really perplexed, because it sounds as if we want no licensure whatsoever. I want to make sure that if I go to a doctor, that individual is licensed and trained and brought up to date on the latest techniques and the latest knowledge. And also, if I have an autistic child or one of my fellow veterans is suffering from PTSD, I want to make sure that someone working in the music licensure field or music therapy field is fully licensed. I don't want someone who hangs out a shingle and claims to be a therapist when they really aren't. And I guess that's all I have to say about that, Mr. Chair. Thank you.
All right. We have a few people on the list. Mr. McGrath, real briefly.
Mr. Chair, Representative Newton, I am in favor of education. I am in favor of training. I am in favor of market signals. What I'm talking about is the problems that exist in this bill.
Thank you, Mr. McGrath. Representative Schultz.
Thank you, Mr. Chair. And I'm wondering, for licensure for Statute 214, what the harm is to the public, or could potentially be, if this is not licensed.
Mr. Chair.
Mr. Schwartzberg.
Thank you, Representative Schultz. I'm looking at a summary of our 214 document, which we did complete back in 2014 at the request of Representative Mack at the time. And I'd like to quote two things out of our summary. False claims of music therapy services delivered by non-qualified individuals present physical, psychological, and/or emotional harm to vulnerable persons. Furthermore, non-credentialed and unqualified individuals claiming they provide music therapy are not trained in mandatory reporting and place children and adults in vulnerable populations at risk. Furthermore, according to Section 214.001 in Minnesota statute, licensure is the only level of regulation that ensures that the practitioner has met predetermined qualifications and persons not so licensed are prohibited from practice, thus protecting title and scope of practice protection. We have a national certification, the Certification Board for Music Therapists. However, it is not a regulating body. Thus, there is no legal recourse to address issues of consumer harm. By having a license to practice music therapy in Minnesota, there would be consequences for misrepresentation from the appointed and volunteer Music Therapy Advisory Council, defined in our bill, for claiming to offer music therapy when not a board-certified music therapist.
Representative Schultz.
Thank you, Mr. Chair. So if someone is not licensed, not trained, how does that harm a patient if they play music or practice music therapy with that patient directly? What is the harm?
Mr. Chair.
Mr. Schwartzberg.
Thank you. Representative Schultz, thank you for your follow-up question. In my experience working with individuals with autism, both children and adults, there can be a propensity towards hypersensitivity or hyposensitivity to sound, to other stimuli such as proprioception, vestibular, tactile, visual, etc. The trained and qualified music therapists through their undergraduate training as well as their master's and even their PhD training receives a rigorous and robust opportunity to take a myriad of classes that prepares them to work with, in this example, appropriately engaging these clients in interventions that will not increase those hypersensitive situations. We may also work with individuals in hospice. We also may work with individuals who are receiving cancer treatments to take the time to carefully assess the types of music that they enjoy, to make sure that we don't use music that might bring up deleterious memories. And as we are engaging in our interventions, be them songwriting, active music making, or lyric analysis in this case, to be able to watch for the nonverbal cues, to be able to have the training and observing telemetry monitors and knowing when one's heart rate or respiration rate or pulse rate is increasing too high. We have that training, we have that experience, we have that continuing education as set aside by the Certification Board for Music Therapists. Another example that I might give as well might relate to those that present with cerebral palsy. I currently have a couple of clients present with mixed and also spastic cerebral palsy in my clinic. If I did not have the proper training to know when I might be hyperextending a certain muscle group, I could do harm to them. And if I don't know how to consult and collaborate with my physical therapist, if I don't understand what they're telling me and recommending to me and vice versa what I'm recommending to them, we could do very serious physical harm to our clients. So without being licensed, there are many other different musicians that are claiming to practice musical therapy or therapeutic music that do not have this diverse training in how to truly respect and treat and protect our clients from inappropriate therapy.
Thank you.
Thank you.
Representative Mason.
Thank you, Mr. Chair. This is to Mr. McGrath. I believe you mentioned the Carolina decision, and and I'm sure we're going to hear about this a lot. So maybe could you do a quick summary of that and why you think that decision relates to this particular bill?
Mr. Chairman, Representative Mason, the Federal Trade Commission has been skeptical since the Reagan administration about the anti-competitive effects of occupational licensing, and it has long wanted to divide the type of immunity that you enjoy as a state legislator and the type of immunity from antitrust litigation that licensing boards enjoy. And so it filed a lawsuit and litigated to the Supreme Court a case against the dental board regarding teeth whiteners. And the important decision that came out from the Supreme Court was that when boards are controlled by an industry, there must be active supervision. That the sovereign, the state of Minnesota, the state of North Carolina, must review every decision in terms of terms of promulgation of rules, discipline against licensees, and discipline against non-licensees. And if the state of Minnesota does not review that, the board is not immune from antitrust litigation, and therefore could be exposed to treble damages. Since that decision, there have been approximately 15 lawsuits filed against occupational licensing boards across the country, raising this concern that these boards act autonomously with no sovereign oversight, and therefore it would be analogous to their meeting in a restaurant or in a conference rooms in their trade association and deciding who can be in and who can be out. And the Supreme Court has said that you just can't restrain trade in that way in the long tradition of the Sherman Antitrust Act.
Just one follow-up. Okay, so what I'm hearing you say is the fact that there needs to be some type of oversight over the board. That is the only thing that relates that decision.
There are
to
two. That's the bright failure of this bill, that it does not provide any active supervision by the sovereign. The second is that there must be a clear articulation of the state's policy. Now, we've done that in 214, and the board must follow as the second element to ensure immunity. The board must follow state policy.
Okay, thank you.
So it's a two-pronged test, Representative Mason, and thank you for your question.
Representative Albright.
Thank you, Mr. Chair. This question goes to Mr. Schwarzkopf again.
Schwartzberg,
I'm sorry.
who's not a general in the rifle.
Thank you, sir. Mr. Schwartzberg, you kind of laid out the description for the process under which a person would go through to become certified and be recognized as a music therapist. It seems a bit daunting that some would go on to be a master's, gain their master's, or even a PhD in music therapy. The odd twist for me is you're going after a master's or a PhD, which comes at no small price to the individual. But the construct that I find a bit disheartening, or you can elaborate for me, is you're doing so out of a love for the patients, no question about that, but for $40 an hour. It seems that there is a dichotomy in terms of the length, the breadth, and scope of the responsibility of the individual to accomplish what they need to do for what seems like a minuscule amount of compensation. So to my point, in your bill, or in the bill that Representative Newton has brought forward on page 9, there's a fairly lengthy section under subdivision 3 under disciplinary actions. Mm-hmm. There is subdivision 4 that talks about authority to contract. Mm-hmm. And then there is a nebulous section number 10 that speaks to unknown and as yet undetermined application fees, renewal fees, duplicate licensure fees, and the commissioner is responsible for all of those. So, to Mr. McGrath's statements, it certainly seems like there is, you're digging a very, very deep moat for people to have the inability to jump over unless they ask the bridge to be let down. My question is, why such a heavy price to pay for little or no request and fees, and a commissioner that's obligated to take care of your group? And I have a follow-up question, Mr. Chairman.
Mr. Schwartzberg.
Mr. Chair. Representative Albright, thank you very much for your questions. To your point about the levels of degrees that music therapists receive at our nearly 74 institutions across the U.S., we are a bachelor's entry level practice. So to practice as a board certified music therapist, one must go through their bachelor's in music therapy. And then, as you can see in the bill, also complete their internship as well. And then they can sit for the board certification exam. Once that's completed, they can practice. Those that go back for a master's degree, or even those that go back for a PhD, they do that to further the profession's research base primarily, and then potentially if they want to be professors at universities. Most of our practitioners here in Minnesota, and I have those numbers, we're currently, where did I write that down? 50% of our music therapists in Minnesota, according to a survey they completed in 2014, 50% are bachelors, music therapists, practicing music therapists. 45% hold a master's, and 5% hold a PhD. I can't speak to why the cost for services is what it is. I know that my colleagues, or I can speak for myself, we love what we get to do. And this bill is truly here to protect our clients and to increase accessibility for our clients to our services. To be honest with you, I did not go into this profession, and I won't continue in this profession to make $100 an hour or make $200 an hour. If for some reason that happens down the road, that's an interesting thing that might happen with the economy. But you know, we do what we do because we love to get to do it, and we're simply here today, and we appreciate the opportunity to be here today to speak to you about how to further protect our clients and increase accessibility of their services.
Mr. Chair. Mr. Chair and
Representative Newton,
Representative
briefly.
Albright, I think also when looking at this, I have a granddaughter who's a physical therapist, and I think that this is very closely in line with $40, $50 an hour to what a physical therapist receives for basically the same training as having a bachelor's degree. And I'm assuming that as they get more education, that the price probably goes up, but I think it's very much in line with what we see for physical therapists. Thank you, Mr. Chair.
Representative Albright.
Thank you, Mr. Chair. I'm going back to what Representative Schultz said, and I'll pose this question to you, to the harm. Because I have had grandparents who were residents of nursing homes and elderly establishments, who on occasion were a participant in a music day at the retirement home. Are you suggesting then that that type of means of invigorating their day, that needs to be regulated, and if they don't hold a license, that somehow the commissioner is responsible for punitive actions against that person who's strumming a guitar or playing the piano for the sake of those residents? I find it, you know, a very slippery slope that we're walking here.
Ms. Furman.
Thank you. That is just an excellent question, and that's really, I think, the crux of why we're here today, which is protecting the clients and the individuals we work with and helping the public understand the continuum that exists out there. So, for example, someone who is a musician who might go into the neonatal intensive care unit, that person doesn't have the same training as a board-certified music therapist who is aware of the impact of the tempo on the respiration and heart rate of the infants in that setting, who is aware of the dynamic and the volume level and the impact on hearing that is critical at that age, as well as the impact of the construction of the music and how complex it is. All of that is part of the research and the training for a board-certified music therapist. In the situation of nursing home and healthcare, it's a wonderful place for a continuum of service, so that there is a musician who might be playing and might be engaging residents. But the closer you get to the bedside, which is what they call it down at the Cleveland Clinic, the closer you get to the bedside and the more fragile and the more involved the clientele, you want to know when you have someone perhaps with post-traumatic stress syndrome who begins to cry, and have a person there who understands the impact of perhaps the music, the words, and what was happening, and can process it because they have the therapy background, not just the music. And so the counseling skills that are built into our continuing ed and into our curriculum. And it's being able to be aware of and clarify for the public that continuum, that a board-certified music therapist is different than a musician, and a license will help us clarify that in the same way that there are physical therapists, occupational therapists, speech-language therapists, and there are assistants in different levels of service.
Representative Albright.
Mr. Chair, and I see that Mr. McGrath might have a response to that, but my follow-on question to the testifiers is, you mentioned that this is a national organization or has national representation. Why then did you not put the fee structure in there for an understanding in terms of why you are unclear in terms of what those fees should be set at as opposed to or compared to other states that might also have this program?
Mr. Schwartzberg.
Mr. Chair. Representative Albright, again, thank you so very much for taking the time to ask these questions. At this time, we have not considered or even begun to write a fiscal note with the commissioner or with our chief authors. We have heard indications from other states, the other 7 states that have either licensure or other regulation, that it's approximately $50 to $75, I believe, a year. Is that what we're hearing?
Georgia.
Yeah, approximately 50 to 70. That was Georgia? Okay. So Georgia, who does have a license, it's $50 to $75 a year for licensure in the state. I also just wanted to, if you don't mind, I wanted to just kind of reiterate and emphasize what Amy just said. I used to have the privilege of working in a long-term care center, Walker Methodist Health Center on Bryant. And I was a certified, I was a therapeutic rec coordinator for an end-stage dementia unit. I provided music therapy for patients who were on hospice. I provided co-treating with physical therapists, occupational therapists, and speech and language pathologists in the rehab center and on the rehab floor. But I would also once a month invite in some tremendous musicians to perform on my unit. And oftentimes I would have musicians performing on the weekends and in the evenings for my residents. By no means are we wanting to tell those folks to cease and desist. They are tremendous musicians, and they provide a tremendous opportunity for improving the quality of life of those amazing folks at our long-term care centers. However, their work is not therapy. Our work follows a very clear therapeutic process, starting from assessment to choosing the appropriate evidence-based approach, to being able to create a goal, objective, and treatment plan, and to be able to monitor if our interventions are being effective. And if they're not being effective, how do we change it and what do we do about it? And then also considering what is an appropriate discharge plan. So there is a difference here between what a trained board-certified music therapist can do and what some incredible music entertainers can do, such as the instance that you brought up. So, thank you.
All right, Representative Fisher.
Thank you, Mr. Chair. I believe this will probably be directed to Mr. Schwartzberg. As we're taking a look at the requirements, originally I was first struck by how many hours of clinical training that were required. And what I was wondering is I've been listening more and more and understanding that it's more of a therapy in line with a physical therapist or somebody in the mental health field. How do the hours that you have here compare to the hours that are required at the similar level in either physical or a mental health therapist?
Mr. Chair, we're going to bring up our third testifier to answer your wonderful question.
Ms. Els.
With your permission. Are hours for continuing education?
As I take a look at what I was looking at is the place where it was talking about completing a minimum 1,200 hours for clinical training, the internship, and then the ongoing experiences.
For the bachelor's level entry degree and then board certification, it is comparable to our allied health professionals. Now physical therapists are moving, they've moved towards a doctorate level in their entry as well. There's certain mental health professions that have a master's level entry, but at present, our board certification recognizes a bachelor's level entry. That's with approximately 1,200 hours of an internship, followed by the exam. So it's comparable.
Comparable. Okay, thank you. That helps as I'm taking a look at it. I can understand on the therapy part how music can have touch people in very different ways. And from my understanding right now, is that almost anybody can hang their shingle out and say they're a music therapist, and actually they may be doing more damage than harm. And I can see that as a society, we should be able to protect people. I too often see people who are preyed upon, who are in disadvantaged situations, or usually lower income, who are easily taken advantage of. And we need to have some kind of standards to help make sure that if people are expecting a certain level of therapy, that they're being provided what they're paying for, to make sure that we're keeping qualified people versus shyster who might want to try to take advantage.
Mr. Chair, we concur with that statement. Thank you.
All right, I think Mr. McGrath had one final comment, and then Representative Newton, if you have any closing thoughts.
Mr. Chairman, thank you. One of the things that would be important to clarify is that under Statute 214, this committee and this legislature has lots of alternatives. It does not have to go to the most anti-competitive, most restrictive, most rent-seeking, most anti-opportunity type of legislation in occupational licensing. Instead, it can use registration. Alternatively, it can use certification. In certification, it is a Title Act, and in Minnesota, we certify interior designers, for example. And so if the proponents of this legislation are making an asymmetrical information argument that the buyers of these services don't have sufficient information to judge who's good and who's bad, who's competent and who's incompetent. That is wrong for two reasons. One is that there are hospitals. I'm sure the Mayo Clinic understands the difference between qualified and unqualified practitioners. And then secondly, that if you have a signaling problem, the best way to address a lack of information is through certification, because you send the market signal as to who has met the personal qualifications necessary to be certified without the high costs and anti-opportunities that are inherent in occupational licensing. So the entire argument that is being advanced here by the proponents, the entire rationale, can be addressed by a far less restrictive type of regulation that is used in Minnesota, and that is certification. Mr. Chairman, thank you for the opportunity to testify today.
Thank you, Mr. McGrath. Representative Newton, before I get to you, I have one final question from Representative Lomer.
Thank you, Mr. Chair. I apologize. It just occurred to me. Representative Newton, or maybe the other testifier could answer this. I'm just curious, with your services, can you bill Medicaid and Medicare without this licensing?
Mr. Chair. And I'm sorry, Representative Lomer, thank you very much for your question. There are some inconsistencies, and we've heard this from our colleagues around the state. It appears that some of our colleagues are being told we can reimburse you through the CDCS waiver, the TBI waiver, other types of waiver programs. And then other music therapists are being told, because you are not licensed in the state, we cannot and will not allocate dollars to you. We've also heard the same from Blue Cross and Blue Shield as well. So here exists an inconsistency, and we believe that that inconsistency may be resolved by the opportunity to not only demonstrate title protection and title regulation, but also scope of practice as well, just as our other related health professionals, such as occupational therapists, physical therapists, and speech and language pathologists.
Thank you.
Thank you.
Representative Newton, closing thoughts.
Thank you, Mr. Chair. Well, it's very interesting. I once again strongly support this bill. I think it's terribly important that we license anyone that's dealing with either the mental health or the physical health of residents of Minnesota. So, Mr. Chair, I would like to ask that you and the committee consider laying this bill over for possible inclusion in the Health and Human Services bill.
Thank you, Representative Newton. With that, House File 2366 is laid over.
Thank you. Thank you, Mr.
And before we go on, thank you very much, testifiers.